According to the National Sleep Foundation, most teens should get between 8 to 10 hours of sleep, but according to the CDC in 2019, only 22% of teenagers were getting those 8 hours or more. Dr. Surani joins us live to discuss. Good to see you, Dr. Surani. Thank you so much for being with us. So why is that? What factors are negatively affecting teen sleep?
Good morning, Barbie. Glad to be here. This is one of the most important issues you can imagine because good sleep is very, very important to get emotional stability, resilience, having a good health. Everything gets connected to the sleep, not only the quantity, but the quality. And what happened is, when I was a teenager, I was going in the class, I was sleepy all the time. And we go to the bed really late, and we see those things among our kids and nieces and nephews. The real thing is, this is not their fault. It's the body circadian rhythm, which is a biological clock. And in the teenagers, what happens is the clock sets where they go to the sleep a little bit later. So in other words, what we call in our term condition called delayed phase syndrome, the melatonin, which is a hormone which helps us to sleep, they start getting up at a little later in the night. And then, they are still there when it is 8 or 9 in the morning, and then they're trying to wake up. That thing was a challenge which was there. And especially in the elderly, we have a phase advance where they try to go to sleep very early and wake up very early. But the challenge with the kid is now also not only that their phase is delayed because of the circadian rhythm, which is our body biological clock, but that is compounded by the social factors. Like now we have the Netflix, we have the cell phones, we have the social media and Twitter, and we see very commonly the kids being up till 2 or longer. That affects the quality of their health, also affect their emotional stability. So one of the key factors is we always say that try to go to the bed before 11. But again, if you need 8 to 10 hours of sleep, and as you mentioned, only 22% of the Americans teen are getting that sleep. That was 2019 data. In 2017, it was 31%. Now it is even lower with all the crisis going on. We need a very emotional stable. Now this mental health has been associated with a good sleep. So that's a very important thing. We need to make sure that our teen gets adequate sleep and try to make sure that they get 8 to 10 hours sleep. Some may need 7 hours, some may need 10 hours, but 8 to 10 is the normal range.
And I feel as they get older, right now I have a little one, but as they get older, they get involved in more activities, sports and all, and now they're getting, back home late. Oh, we need to get tougher on these kids and get them to bed earlier. Thank you so much, Dr. Surani, for being with us. If you have a question for Dr. Surani, you can send it to the number on your screen, 361-855-6397.
Sometimes they don't know how you do it.
Goodness gracious, let me tell you, it's getting tougher and tougher. It really is.
I can imagine, especially during the summer for
yes,
many parents.
they want to stay up all night and be a rock stars.